Hello, I'm Dr. David Rosensweet, and you've tuned into I Wonder Doctor Live. And this is a time that I love to answer your questions. If you call in, you could call in to 888-502-8886. And we also receive your questions through our website, iwonderdoctor.com, through Ask a Doc, and we always have several of those to answer. So today, I'd like to talk to you first about a subject that's near and dear to to so many people who have mysterious issues going on. And picture this: Suzanne, a mother of 3 toddlers, comes into my office, and she's complaining of severe pain in her hands. Well, sure enough, she had already been to an arthritis doctor who told her that she had rheumatoid arthritis, and he gave her anti-inflammatories and even an immune suppressant, because the immune system is involved in arthritis. It's overactive. It's attacking her own joints. And although she was getting relief from that, it wasn't thorough enough relief, and she was really concerned about taking the medications, especially the immune suppressant. Well, let me take you to the flip side of what we uncovered, something called leaky gut. In other words, her intestinal tract had something to do with this arthritis. And let me connect the dots for you. Well, just in general, in the early 19th century and, centuries before and still to this day, doctors, many health-oriented doctors, were saying it's the intestinal tract. It's in the intestinal tract. Good health begins with a good colon. And there was tremendous emphasis on enemas and other ways to work with the intestinal tract for good reason. Because here what happens. You swallow food, you chew it, you digest it, and it breaks it down into the tiniest of molecules that are so small they're able to fit through the intestinal lining. Let's pretend this is the intestinal lining and the food is in the tiniest of particles, and it gets to slip through the cracks between the cells. They exist, and also gets carried right through the cells. And that's how the food, broken down to its teeniest size, makes it in the bloodstream and gets distributed to all the cells of your body. Well, what happens if, for example, the food doesn't get completely digested, and you got bigger molecules of food that don't fit through those interstices? They don't fit through. And that's the body's protection. But let's say that the spaces between the cells got wider, and then these larger molecules, partially digested food, could actually slip through those interstices between the cells. Well, larger molecules in the bloodstream, your body goes, what's this? This is too big. What can we do with these molecules? They're not going to work. And it sends out the immune system. And the immune system actually, shall we say, attacks those 2 large molecules of partially digested food and disintegrates them into where they're usable. The immune system is handling your meals. Well, what happens if the immune system, which connects up with these partially digested food particles and forms an antibody, that's how it identifies abnormal or strange molecules, and the antibody circulating around the body, and there's something in the body that looks similar to the partially digested food. That means the antibody that formed to attack molecules of food that were too large can attack somewhere in your body. Joints, for example, is a common location. In other words, partially digested food slipping through spaces between cells that are too big can make antibodies form that can attack your joints. Autoimmune disease. Autoimmune means we don't know why the immune system is engaged in attacking your own substance, your own tissues, but we do know it can always be traced. There's always causes. And in this case, the antibodies that form to complete digestion of the food went and attacked the joint protein, creating arthritis. And what did we do? We helped her heal her leaky gut, and the way we did that is we identified a few abnormal critters in her gut that were bothersome critters that were capable of causing infection rather than just being present there and peaceful. We eliminated the critters through taking herbs and medicines, and that let the inflammatory process that enlarged those spaces between the gut cells to relax, to go back to normal, and then those larger molecules were prevented from going into the bloodstream and provoking antibodies, and that calmed down the rheumatoid arthritis. Leaky gut. The spaces got too big, the partially digested food got into the bloodstream, antibodies formed, attacked the gut, rheumatoid arthritis. And other autoimmune illnesses have some kind of provocateur to the immune system. These things don't come out of the blue with no causes. Everything has causes. Now, another thing we did is we treated her with digestive enzymes and hydrochloric acid, because part of the problem was the partial digestion of the food. And another thing we did is we carefully inspected her diet, because some foods are less likely to digest, and they're more likely when they slip into the bloodstream to cause an immune response. And what's the most common one? Gluten. And I remember my 4th grade or 3rd grade grade school class where we made paper mache. I was fascinated. We took paste, white paste, added water, and it turned to rock, the paper mache. And where did that came from? We had water to white flour, wheat flour. It has this gluey molecule in it called gluten. It's a tough molecule to digest. So some people have leaky gut provoked from eating gluten, which means all wheat products and some other products that are related that also have gluten in them. So when you go into your store and you see all this stuff around gluten-free, it's a big deal. And how did it make it into the stores? Because a lot of people have trouble with digestion, and thus are going to have trouble with the harder molecules to digest, such as gluten. Well, we actually go further than that. We do something in which we test antibodies against many foods to see if there's any other foods in someone's diet that could be provoking an immune response. And what are they? The most common ones are the foods that are challenging to digest, including pasteurized dairy of all kinds of stuff. There's a protein in there that's tough to digest. And so someone who has a major leaky gut, one way to approach it is change the diet to eliminate the commonly known provocateurs to the immune system. And what is that? Wheat, dairy, and soy. So and corn. So those are some of the first things that are done in an allergy elimination diet. Allergy, immune response. So you want to protect that immune system and get it to quiet down. Check out whether the gut is part of the whole issue. It's phenomenal. Leaky gut. You're going to hear more and more about it. And of course, there's many of you out there who have heard plenty about it. But so many illnesses can be tied to the provocation of the immune system by partial digestion and antibody formation to the food leaking through a leaky gut into the bloodstream. So, chew, chew, chew. Remember that. Oh my goodness, one of the strongest tools you have to break down that food into the tiniest of tiniest molecules all begins with chewing. And if you do a great job of chewing, that makes the stomach enzymes and the hydrochloric acid, it's able to work on the food so much better than if you are swallowing chunks of stuff. It's a physics principle, and we have videos on this in I Wonder Doctor in the digestion system section. And leaky gut. So now I'd like to turn to some of the questions that were sent in to us. And we have a question here from Linda in Surrey, Canada, outside of Vancouver. We have family members that live in Vancouver, that gorgeous place that you live in, that whole area. And Linda's question is, my cholesterol came in high and my doctor wants me to take Lipitor. I don't want to get on a bunch of drugs, but I don't want to be foolish and skip them if they are actually important either. How do I decide? Are drugs always bad? Put another way, is the damage of the cholesterol worse than the damage of the drug? Oh, this is a good question. And one reason I like it is elevated cholesterol is so epidemic in this modern world. And of course, the anti-cholesterol drugs, the cholesterol-lowering drugs, are so popular, and they're not innocuous. They've got some very significant side effects that can occur. And just an aside for anyone who's on a cholesterol-lowering drug, make sure you're also simultaneously taking CoQ10. It's a nutritional supplement, because these cholesterol-lowering drugs interferes with that crucial nutrient inside of our body. But back to your question, are drugs always bad? I'd like to just address that. No. Oh my goodness. Drugs can be, and for me, the best use of drugs is when things have gotten out of hand and you want to create safety for somebody. So for example, if someone came into my office and they had a consistently elevated blood pressure of, let's say, 180 over 120, it's not okay to tolerate that. You know, people can get away with that, but some people don't. So I love it that we have medications that we can give that patient. Now there's always causes to elevated blood pressure, but the pharmaceutical medications help you buy time, get that blood pressure low and safe, and figure out the causes and deal with them over time. And many people who do that, sooner or later they're able to eliminate the medications. And geez, I mean, I'm a holistic doc, I always have been one. And you know, to me, that includes everything. So even chemotherapy, when it's needed, it can be manna from heaven. I never rule out anything. Yet, do I like to find other approaches? I do, because for one thing, there's always causes to all these things. So let's start with cholesterol. How did that get up? And the most common way that cholesterol rises is there's dietary and stress reasons. And so, interestingly enough, cholesterol, we need cholesterol, it's crucial for us, and that's another aside of anyone taking cholesterol-lowering medications. Make sure it doesn't go too low. Cholesterol is the foundation of producing a lot of your hormones. And so people who get low hormones, they start getting very uncomfortable and get into emotional issues. So make sure your cholesterol is good enough. And then, what drove up that cholesterol in the first place? And usually it's excessive simple carbohydrates, sweets. If it's sweet, that could be one of the drivers. So one of the things that you want to do is take a real close look at your diet and sort out, or with a professional, sort out, is there too many carbohydrates in that diet? And people who have done some dramatic things to lower that cholesterol, such as cut out lots of carbohydrates, all the sweets, all the processed foods, which are loaded with sweets. If it's in a bottle, box, or can, there's a high probability that it's got added sugar in there. What does it take you back to? The farm. Back to whole vegetables, fruits. And people who have high cholesterol, we also want to even lower their fruits, get the sweet fruits out for a while to see if we can lower the cholesterol through the diet. Now, is high cholesterol a problem? Well, there is a problem, and cholesterol is a clue about the problem, but there's different types of cholesterol. So one thing as a physician I always do when I see an elevated cholesterol is I do a sophisticated but very common, easy to do particle size of the cholesterol, because there's big fluffy bouncy cholesterol, for example, and we've got animations of this in our I Wonder Doctor section. And gee, we encourage you to watch the diabetes section. Interestingly enough, cholesterol shows up there big time. And this is not dangerous cholesterol, and it's not going to attack the arteries. The real question is, what's attacking the arteries? Why are the arteries getting inflamed? If an artery gets inflamed, cholesterol is very much more part of the repair process. But the first thing was what provoked the arteries to get inflamed. And so we look at that, and one of the most common things of all, again, relates to diet, to too many simple carbohydrates in the diet, to sweets. They drive the insulin up, And the insulin's a little harsh on those arteries and can trigger inflammation. And also a very small particle, cholesterol, can also injure those arteries. And also not having enough antioxidants in your diet, oxidation can injure those arteries. So I'm going to refer you to our I Wonder Doctor series on diabetes, because we go into this in depth about cholesterol. Do I leap to treating someone with cholesterol-lowering drugs? I do not. I examine what kind of cholesterol they have, and I try and look at the causes. And there's the introduction to that story. And then again, look at our videos. You'll see a lot more detail on that. Ultimately, I'd have to make other assessments. The bottom line on cholesterol is, are you getting arterial damage? What kind of arterial damage are we talking about? Coronary artery and cerebral artery damage. Well, this type of situation is also diagnosable. So we go through levels and layers of sophisticated testing, like a treadmill test, or even a nuclear treadmill test, or even there's imaging studies that can be helpful. But we want to find out, well, if you have elevated cholesterol, is it the more provocative type of cholesterol? We can find that out in the blood. Do you have increased inflammation? We can learn a lot about that in the blood with a highly sensitive C-reactive protein. And bottom line, are you getting some kind of injury to the coronary arteries? So it's a series of steps, and you've got time. If you're young, you've got time. If you're having symptoms, start with the cardiologist. If you're having chest pain that you don't know about, if you have chest pain on exertion that you don't know about, because I don't know how old you are, Linda. But if you're having symptoms of heart or chest stuff, then you check in with the cardiologist or your doctor. Your doctor knows all this. I think if they didn't ask you for an EKG or a stress EKG, you'll be fine. Don't want to make it too complex here, but the good news is there's so much is known about cholesterol and how to assess cholesterol and how to assess arterial damage and how to address it. Start with lowering the simple carbohydrates out of your diet. Be even extreme for a while. We need carbohydrates, but we don't need a lot of them, and we don't need the simple ones. And retest after you've really combed your diet thoroughly and eliminated a lot of the simple carbohydrates. That's a great place to start. Okay, Linda. Once again, I get this image of how lovely Vancouver is, the whole Pacific Northwest. And we have a question from Ann H. in Sarasota, Florida. Well, I know Sarasota, Florida because I'm sitting right here in Sarasota, Florida right now. What are some options for an 80-year-old with numb feet? Would an osteopath be helpful? There are options. Sometimes there's a little bit of irritation or inflammation or issues with the nerves that are going to the feet, and they're a long distance from the rest of the nervous system. They're about as far away as you can get. And there have been elderly folks who happen to be B12 deficient, which it's easy to get B12 deficient for all of us. And gosh, an old-timey trick of general practitioners, I grew up in Michigan and went to medical school at one of the finest specialized centers in the world. And there was these people coming in, these patients coming in from all over Michigan, including the Upper Peninsula, and so many of them were on B12 injections. And I'd say, you don't need those B12 injections, that's just that country doc stuff. And they would say, look, don't tell me about my country doc, for one thing, and these B12 injections help me enormously. And bottom line is, B12 injections can help people with neuropathy. And that's the place I always start. And the injections are easy to do, and it's probably pretty easy for you to connect up with someone who will supply you with the injectable B12. I like methylcobalamin or hydroxycobalamin. That's not the most common one out there, but any holistic or functional medicine doctor will be able to supply that to you and teach you how to inject the 80-year-old gentlewoman or gentleman, or teach them how to do it. And I would inject daily. I'd start with 5,000 micrograms or at least every other day for a week. And then I'd go to 5,000 micrograms twice a week. And then you could eventually cut down, but that dose is going to be strong enough for you to see within 3 weeks, plus or minus, whether the numbness went away. And that's one of the simplest issues to address, and you'll love it when it works. Now, it's not the only thing that causes numb feet in anyone, especially the elderly. And another thing is it can be circulatory and related to diabetes. And so almost any physician that you can think of, a general doctor or an internist, they're going to take a look at those feet. They're going to examine them. They're going to feel the pulses. They're going to see how the circulation is. The circulation can be disrupted by diabetes. If the circulation to the nerves isn't good, you get neuropathy. You can get a diabetic neuropathy. That's one of the more common causes of numb feet, is inflammation of the nerves related to diabetes. So that would be more, there'd be more there to do to address that. And then would an osteopath be helpful? Well, I love osteopaths. They have a body of knowledge that is really special. And one of the things they're looking at, is there any compression on the nerves? Well, the nerves to the lower extremities, they're under a special duress because we're walking upright, and by the time you get to the low end of the spine, it's bearing most of the weight there, so it's not hard to get nerve root compression or nervous compression that's going to affect the functioning of the nerve, or even as the nerves travels through muscles. And so, my goodness, I definitely have gone to osteopaths for years and years and years. I think they're really special, and I really love their techniques. So you have the intuition because you're asking the question, and so I say follow your intuition there and have an osteopath check it out as well, because there could be pressure on the nerves that they're not working because there's pressure on them. All right. Here's a question from Lila in Virginia. Can a person take too much vitamin B12? Well, that's coincidental. And are there side effects? How would I know? Well, B12 is a water-soluble vitamin. And that means that you can take a lot of it and it's not going to store in your body. The kind of things that store and build up in your body are fat-soluble vitamins like vitamin A or vitamin D. And it's crucial and necessary, essential, that vitamin D and vitamin A are to us. You can take too much and that'll build up in the fat, and too much of anything is pretty much toxic. Too much water is toxic to us. But this doesn't happen with the B vitamins. So you can take a lot of B12, and my goodness, do I know this, because I had a very active intravenous nutrient practice where I gave people intravenous dosages of vitamins and minerals and amino acids and lots of things. And my goodness, I also would give those to myself and my family rather frequently because they're a wonderful boost. And I would give a lot of B12 in there, 5 to 10 milligrams. That's 5 to 10,000 micrograms intravenous. That's not a way that you need to take it. So I don't know anyone who's going to go to the trouble to get overdosed on B12. Even if you buy a sublingual B12 and you buy a 5 milligram tablet, I haven't seen, and they may exist, but I haven't seen strengths larger than that. Well, how many sublingual B12 5 milligrams are you going to want to take in a day? But if you took one a day, which I do anyway, under my tongue, because B12 is challenging for the stomach to digest, it requires its own specified, designated digestive factor called intrinsic factor, and you need adequate hydrochloric acid. So going back to Linda, this is why I didn't recommend that the elderly person that you were talking about necessarily swallow B12. I said inject it. But Lila, I'm not sure how old, it was Ann H. With the 80-year-old. And Lila, I don't know how old you are, but you know, it's hard. You'd have to go way out of your way to take an overdose of B12 to begin with. So take 5 milligrams sublingual a day, 1,000 micrograms or 1 milligram a day, 2,000 micrograms or 2 milligrams a day. This is how it's actually supplied, and you're not going to want to stick 1 or 2 or 3 or 4 or 5 under your tongue. So it's reasonable. You take a reasonable dose, you'll not be able to exceed it. And even if you're injecting it, it's hard to get too much B12 because it's not going to stick around in your body. Your kidneys are going to pee it out. So B12, a wonderful supplement to take because very often even if we get enough of it in our food supply, it's challenging for us to digest and assimilate, especially the older we get. And that is the total of the questions that we have for today and I Wonder Doctor. And so, until next week, and email in your questions to I Wonder Doctor, ask the doc, or call us every Thursday at 1 o'clock. We answer your questions. We would call in at 888-502-8886. And I'm Dr. David Rosensweet, and it is always a pleasure to be with you. There was one other question, and I have to look up the answer. It was from Ann H., and it was around vitamin K